Hi, everyone. And it's also game day.
What? Look at this Astros gear. I should have worn a hat.
Dang it. This one.
I don't actually know if I look really good in hats.
I know. I haven't decided if I'm a hat person or not.
I'm back and forth on the hat thing, especially with the short hair, the long neck. Just sometimes not a good situation.
Anyway.
Okay, so fear no more. The
We're back.
is back.
This is really me.
Yeah, okay, so you don't need to adjust your contrast. Ashley's back, but she's just a tanner version.
Very tan. Don't tell Jana.
Don't tell Jana.
No, for real. When she saw me, she was like,
mm.
I just have no words.
She did the eye roll because
I did do a lot of sunscreen. It's just when you're out, like in the
it reflects off. So.
Exactly.
Yeah.
So.
Okay, well, I'm so excited Ashley's back. You guys have no idea.
I know. I missed
no idea.
Jill.
It was weird doing it last week by myself. I felt like I needed somebody to talk to.
Yeah.
Instead of like someone in my head.
Like when I was watching it, I was like actually like going back and forth.
You were doing you.
Like, yeah.
Well, okay, so today we're talking about something really cool. I think this really gives us the nickname the Fountain of Youth. The procedure Dr. Sukar does.
Definitely.
And it's ridiculously amazing.
It's incredible.
So,
I'm pretty sure the very first day I started with Dr. Sukar, that was the first procedure that I saw, which was a little intense, but
totally
when seeing the process, like the whole process, as like a newbie was just, I was like, so he has like a magic wand, right? Like how did that happen? If you've come to our office within the last few months, you've seen our wall of phenol. So that has some of our fave results there right next to Jana's room. It looks like it's 6 different people.
It really does. Like we've had so many patients ask, like, that is that person?
Yeah, it's
no
weird.
way. No way.
Yeah, and then one of the patients, she said that she gets mistaken for the daughter.
Versus being the mom.
Versus being the mom. Yeah.
We hear that all too often, and we love it. Love to hear it.
So 2 of our family members have actually gone through the process.
Yep.
And love the results.
Absolutely.
Who's mommy?
Well, one is my mom. This girl.
Hi, Pauline.
Yes. Hey, Mama Bear. So,
Pauline looks as young as you.
Girl, can I just tell you, my mom gets compliment on her skin by men. Men don't notice these things, but men my age compliment her on her skin. I'm like,
she's also
my husband doesn't even know when I change my hair. Like, how do strangers, know to compliment you? So it's been a phenomenal game changer for my mom. So let's talk about phenol and what it is.
The other person, by the way, is Mary's mom, who actually keeps a before picture in her purse whenever anyone compliments her skin.
She's like, you need this.
Yeah.
This was me before, and no. So, yeah.
So, let's talk about it. Hey, Jess, I have a little surprise for you here.
Oh, do you?
I'm going, I went into the Sukar library this week, and I have some information for you.
Oh, okay.
About
take notes.
about how phenol peeling and phenol and chemical peeling kind of started.
Okay.
So
lay it down. I'll pick it up.
Let's go all the way back to ancient civilizations.
I'm taking it way back.
Yeah.
Taking it back like the Astros take it back?
We're going to take it
back.
Oh,
yeah.
We're about to take it back. All right.
Let's take it.
So,
lay it down.
We know from the Egyptian Nefertiti, like all of those beautiful women, that they worshipped aesthetic beauty, and they sought out to find remedies for aging skin. They were really concerned with pigmentation, wrinkles, irregularities. There has been so many studies that have been found about. I don't know how you find that stuff out because there was no Facebook or whatever. So
there wasn't Google
fossils,
or
I guess,
Wikipedia
or whatever. That they would use different chemicals, different things in the in the nature to try and derm their face,
dirt and plants.
Yeah,
and
crazy stuff. So the oldest written record of a cosmetic treatment was by these physicians, right? Not actual doctors, but this is back in 1560 BC. Okay, and they wrote this book like the Eber's Papyrus or whatever, and it showed like how to dye your hair, how to dye your eyebrows, and then how to like remove wrinkles. And they would use these chemicals, right?
So what chemicals
So,
do they use?
I don't know. They didn't tell me that.
Oh, dang it. Well, how am I supposed to know how to do it?
Well, you're not, because Dr. Stukar's going to do it. Okay, so it was 1903 when this dermatologist started using phenol as a way to prevent acne scars, or a way to take them away, right? So then it wasn't until 1950s that, are you impressed right now?
I'm picking it all
in the
up.
1950s,
All you're laying down, I'm picking it up.
chemical peeling became known as the fountain of youth, and all of these doctors were like super skeptical. They're like, y'all are making up those pictures.
Like nope, can't be true.
You bought them from Dr. Sukar or something? No, just kidding. That was 1950s. So they were really skeptical, and it wasn't until like plastic surgeons got into like, let's pioneer the study, let's start like
Making people more
trying
youthful.
to, yeah, exactly.
Yeah.
Let's start trying to manipulate these chemicals in order to actually,
these results.
yeah, exactly. They did it in the ancient times, and let's do it again, but let's do it safer, and let's do it the right way.
Legit.
So, that is the end of my, well, thank you very much.
I am so impressed. Can we get a round of applause? Dang, girl. That was good. I love that. So, as far as chemical peels go, so if you've been to our practice, you know that we do a lot of chemical peels around here. However, the phenol peel is the one that Dr. Sukar does, and it does require you to go to sleep. So, and it's not long. There's no cutting, nothing like that. But it does require you to go to sleep so that we make sure you're 100% comfortable while receiving it.
So this is different than the chemical peels that you get done with Jana and spa, whatever, because this one is a lot more intense.
Right.
So most of the chemical peels that you get on the spa side are going to be like TCA based. They're going to be different. They're not going to have.
They're not going to have as much downtime, right? So,
definitely.
Hi, Melissa. We miss you
Hi,
too.
Melissa. I was just talking about you with your daughter,
Mm-hmm.
and how I love you more than she does.
We're kind of obsessed with you, Melissa.
Hey, Miss McClure.
Hey, Kimberly.
Oh,
yeah,
yes,
girl.
we have a Phenol fan.
Yep. So, okay. Let's actually like backpedal just a little bit. Like, who would be a candidate for phenol peel is usually what most patients want to know. Like, am I a candidate? Are you a candidate?
No.
Who's a candidate?
I mean, no, she's not. I'm not.
So patients who are candidates are ones that are really wanting to address any fine lines, wrinkles, texture issues. Now, you did mention something about acne scarring, so I do want to touch on that because I really want to, because this is super important. Okay.
Yeah.
So when a patient has acne scarring, they have very fibrous, dense tissue, and they typically don't heal as well, because that's why they have got the acne scarring, because they had an incident, breakout, whatever, they mess with it, and then we cause this irregularity with healing, pitting, things like that.
Yeah.
So phenol peel is really not, we don't use it to take away acne scarring. We have another particular treatment here that works fantastic for acne scarring.
And that's better and more targeted for that.
Exactly for that. Phenol peel is great for wrinkles, lines, things like that. So, actually, I'm so glad you said that, because we were just talking about this earlier.
Mm-hmm.
So, hyperpigmentation is great. It'll address that, and wrinkles and lines. That is really what phenol peel is for. And patients either who've had a facelift and want to address some texture issues, and or not quite ready for a facelift but have facial wrinkling, phenol peel is fantastic. And I'll tell you actually how we did it for my mom. So my mom, when we did her phenol peel, wasn't really quite ready for a facelift yet, but she did have some wrinkling, some fine lines and texture, but more pigmentation really, just from being in the sun for years.
Sun, yes.
Baby oiling it up, living the life on the beach house and the boat, and so we've got all that damage. So my mom wasn't really quite ready for a phenol or facelift, so we did a phenol first.
Freckles from this?
You might.
From my
You just caused a ton of damage, but you won't know for like 10 or 15 years from now.
Okay, good thing I work for an amazing plastic.
Exactly. So we did a phenol first to really smooth the canvas, bring life back to her tissue, brighten things up, and really take her skin back to her baby skin. And that prolonged having to do any type of tightening procedure.
You think that we're just kidding and just like, oh, that's just what they're saying, like baby skin.
No, like I feel
baby
like as
skin.
I approach 40, I'm going to need a phenol to keep up with my mother because her skin looks so amazing.
Yeah. So let's talk about, okay, so someone that comes in early 30s, probably not.
Right, unless they have some very, very advanced signs of aging, lots of skin. And actually, one of our photos we're going to show you, this patient was in her late 30s, so that's why I wanted to toss that in there.
Yeah.
So.
Okay, but someone like me.
Or me, I'm in my early 30s. Really, I'm like 64, you just don't know.
I know, isn't that funny? She really is. So, let's talk about coming in, what's going to happen in your consultation.
Okay, so during the consultation, of course, Dr. Sugar is going to assess your tissue to see as
you
far as
might come in and say, hey, I'm coming in for a facelift, and we might be like, wait,
pump the brakes, sister, you don't need it yet.
Let's show you this amazing thing.
So we want to address the canvas, right? We want to get the skin in the best condition possible before we approach the facelift situation, unless things are so advanced laxity-wise. So when you come in for a consultation, Dr. Sugar is going to assess, you're going to tell him what is bugging you, what's driving you bananas. So we're going to address that. However, we're going to assess the skin to see what condition it is as far as texture-wise, wrinkles, fine lines, okay? So if things as far as wrinkles and fine lines are at that point where they are advanced, whether you've got the lines around the mouth, if you've been a smoker.
Perioral.
Oh, girl. This one. Yo, were you doing that on vacation?
Yeah.
You were by the pool, reading, studying, getting ready?
Uh-huh.
So we're going to assess the skin to see what condition it is in. And if you are a candidate, Dr. Sukar deems you a candidate for the Phenol Peel, then that's what he's going to recommend so we can really smooth the tissue and, again, bring you back to your baby skin. I can't stress it enough, but that's the best way to describe it because of how wow the results are afterwards. Yeah. So once we decide that.
We decide Phenol Peel is the right way to go.
We got to do something.
Then we're going to prep you.
Exactly. So, what is the prep phase?
And not just a prep, we do prep for all of the procedures, right? We want you to not take certain medications. We want you to have a healthy diet, all that kind of stuff.
All that good stuff.
This, we need to prep your skin.
Right.
And all these ancient books that Dr. Sugar has, they all highlighted the preparation phase as being very, very important.
It is extremely important when it comes to this process because when we do a chemical peel, we want it to penetrate all the way down to your tissue evenly, not some penetrating here, some here. We want your skin prepped and open and ready to receive this peel. And we want your skin's response after the peel to be a very positive response, and we want things to heal very quickly. So the prep phase. We put you on a treatment, a product regimen.
This is where Jess comes in.
Yes. Hold on. Hold, please.
So, we call our spa aficionado into the consult room with you, and she is the one that's going to put you on that.
Yes. So, we're going to prep your skin for a minimum of 2 weeks before your Phenol Peel. The further out, the better, but at a minimum of 2 weeks. So, don't feel like you need to push things out further just because you want to do longer. Longer is fine, but a minimum of 2 weeks is perfect. Okay, so we prep your skin. We give you products, a regimen, and we give you exactly what we tell you what to do morning and night, so you know every single day what to do. Okay,
we want to set you up for success.
Exactly,
because the success
failure is not an option. So
it's so.
Yeah,
come on.
It's amazing. So we give you the products. We tell you your regimen for morning and night leading up to your procedure, exactly what to use, what to do, how to take care of your skin. And what this is doing is this is slowly peeling off some of those dead layers, just kind of working them down, and then allowing
you to the
exactly.
Good
also,
stuff.
what happens is when you have an injury to your tissue, you have melanocytes, which are pigmented cells. Okay, so when you have sun exposure outside, those melanocytes are activated, and you have hyperpigmentation, sunspots, age spots, freckles. Right. So when you have an inflammatory response, some skin tones have those melanocytes activated, and you have what's called post-inflammatory hyperpigmentation, and we don't want that. Okay, which means you've got pigmentation after the reaction or treatment.
PIH?
No. Post-inflammatory hyperpigmentation, PIH.
Isn't that a thing? Don't we call it that?
Yeah.
Okay, yeah.
Yeah, absolutely. Yeah, girl. So, we want your melanocytes to be regulated. It's kind of like crazy toddlers. We got to calm them down and allow
that.
Oh, girl, do I. I do. So, prepping your skin allows the chemical peel to penetrate evenly and deeper so that we get the best result with the procedure. Okay? So, prepping 2 weeks before. Okay. Procedure time, how long do you think the procedure is, Ashley?
to get to rewind about 20 years, I'd say you'd have to be in there all day long.
But today, in Dr. Sukar's OR, how long does it take, you think? Do you know?
Well, I do know, so...
Oh, okay. You want to tell me?
Is it like 30 minutes?
Mm-hmm. You're like, should I guess? I don't know what you guess. Yeah, so it's about 30 to 45 minutes for the procedure. So it's not long at all.
Let's talk about why you have to be put to sleep. A phenol peel is essentially a, what's that word? A controlled
I like to use that
chemical
term.
burn.
Yes, it is.
We're burning off your skin, but in the best way possible.
Mm-hmm. Yeah.
So we're taking 20 years. In some cases, I've seen what looks like a lot more.
Yeah,
but we're taking 20 years of skin and
damage,
everything you've gone through, heartbreak and anger and, the lines and stuff. All that, like, just all the bad, all of the... all of the ex-boyfriends, we haven't had a guy. Can a guy do it?
Mm-hmm. Yeah, we have. We actually had a famous newscaster, which we can't say names, who did the phenol peel years ago.
What?
Yeah.
Was anyone going to tell me, or is this stuff that, like, is going to be in the book?
When we have famous people, we have to keep them under the radar, so even some staff doesn't even know. You know?
That's not fair.
Know what I'm saying?
Okay, anyway, so it's a controlled chemical burn. Mm-hmm. And in all of the book, there's tons and tons of books written about how careful you have to be. And a lot of surgeons, a lot of doctors, they don't do it because it takes such meticulous, like, measuring and, like, you have to be super,
beyond
like,
skilled for this.
Mm-hmm. Yeah.
Which is why Dr. Sukar, we have patients fly in from all over the world, outside the country, in the States, that come to him for this particular procedure because he's one of very few that do it and do it right. Exactly. Mm-hmm. Yeah. So, hey, Sydney.
Oh,
hey, pretty lady. She said, best thing ever. Yes.
Oh,
yes, girl.
Kim, post those pictures, girl. I love before and after. She said she has pictures from 2015 to 2019.
Yes.
Yeah.
Oh, Kim, please, will you put them in the comments?
Oh, you see, hers was 30 minutes.
Yeah. It really isn't a long procedure. So, okay, so let's just talk really quick about what's in Dr. Sukar's secret sauce. I'm not going to give you all the juicy details.
it?
I do, actually. Mm-hmm. I would never.
Dr. Sukar, I would not tell Jess because she talks.
But I would never tell anybody what the secret potion is.
Okay.
So I'm only going to give you 2 ingredients of the secret sauce to phenol. Okay? So
is one of them phenol?
I don't know. Is it? Yes. So phenol is in the phenol peel. That's actually one of the major ingredients. The other ingredient in it is croton oil. So these are 2 of the main ingredients in it. I can't tell you the rest because I can't spill the secret sauce because I just can't.
No, because
it's locked. What's that commercial? Is it it's with a dog and he's like wanting him to spill the recipe.
Oh, the beans. The baked beans.
Oh, yeah, it is
yeah.
beans. Yeah.
Bush's baked beans, right?
We got Dr. Sugar has it locked up in the safe. So
yeah, which is that?
Mm-hmm. So phenol and croton oil are 2 of the main ingredients. There are other ingredients in it. I can't tell you, but it's all good stuff.
Yeah.
So okay, so we talked about who's a candidate, prepping. You go to sleep. How long it is?
Let's talk about the
recovery.
The
after
hard part.
It's okay.
Yeah, but it's
really worth it. It's not really even hard.
We're going to hold your hand every step of the way. Yeah. It's not hard. It's just okay. And we're gonna have another episode. And I keep saying we're gonna have an episode about this. Mm-hmm. Plastic surgery is not the easy way out.
It's not.
It's just as much a sacrifice, and you have to put in work. You do.
It's an investment of time, right? Because you have to go through recovery if you're going to do it. Obviously, there's a financial investment, but it's an investment of time and a lot of effort.
And especially for this one because we want to set you up
for success.
So
absolutely.
We put you on pre-stuff, and then afterwards
you do get to put on a post-care regimen too. So
yeah.
We guide you through it, sister, so don't worry.
So you went through it with your mom. Mm-hmm. Walk us through the days and the weeks afterwards.
Okay, so day of procedure, patients obviously are going to go home groggy, sleepy. I'm good. They're going to go home groggy, sleepy after the treatment or the procedure, want to sleep. Okay, so when you leave here, having the phenol peel, you are like a cake with all sorts of icing all over. It's Vaseline. Okay, so we wanna keep that skin protected. So we ice you down like a cake. with Vaseline. And we want that Vaseline, a very, very thick layer, kept on all throughout the day, making
What
sure
color is your face?
Well, it's kind of gray, purpley looking the first day. It's kind of crazy.
Mm-hmm.
But, and you have swelling. You do definitely have quite a bit of swelling.
Yes.
The first 24 to 48 hours.
Mm-hmm.
A lot of times, you know, things are so swollen that even around the eyes are swollen. So we prep you for that. It's cool.
We prep
you
your ride also.
Yes, so they know exactly what they're getting themselves into.
Mm-hmm.
But most patients actually don't experience a lot of pain or any pain. I will tell you the first time my mom did say her skin felt hot and warm, but it wasn't that she was like dying in pain or anything. She just said it felt hot and warm. So I kept a fan next to her to keep cool air on her, and then we've got some tips and tricks for things to keeping their skin feeling cool. So we'll give you those when you plan your procedure.
Mm-hmm.
But I like that. See,
You like
you should have got that. Okay, so first night, patient sleepy, groggy, feeling warm and hot, nothing like crazy uncomfortable, nothing no one can handle. The following day, my mom had zero pain. Okay, she did have swelling, which was fine.
Signs of a great surgery.
Exactly, we like swelling. We're like, sometimes a little pain is good.
I was actually talking about the no pain part. Yeah, I know. I mean, but why not feel comfortable?
Yeah. So swelling, but really no pain for my mom. Let's fast forward a handful of days. So as your skin begins to start the sloughing process, all that damage beginning to come off, okay? Things are going to get a little ooey, a little gooey. It's fine. And a lot of it is from the Vaseline, the very thick layer of Vaseline that you're going to keep on your skin.
Think about when you have like a scratch. You
like
know how
scab.
when the scab is kind of yucky and it doesn't hurt, but it's just kind of yucky looking.
Yeah. So we are going to have some ooey gooiness, okay, that's going to happen.
You will have downtime where we do not want you, like, if you go
like,
out in the sun, you need to wear a hat, and not backwards. You need to wear a hat,
like
protect your face.
beach,
like
sun.
a beach one, yeah.
Yeah. So
I want to get some PS ones, actually. That would be really cute.
I love that. We definitely should.
Yeah,
Okay,
but we didn't have
so
it for a trip.
recovery, most patients need to anticipate at least 2 weeks of downtime. Just hang out at home, find a bazillion Netflix series that you want to watch, binge watch them, read books, crossword puzzles.
Oh, and we'll give you a husband's note that you can't really cook. You don't need to be over, open flames, all that
I
stuff.
like that. So, yeah, I like that. So 2 weeks of downtime, you're just going to be ooey gooey, okay?
Mm-hmm.
Once you get to anywhere from about day 10 to 14 is when your resurfacing process is going to end, and then you're going to see this very nice, tight
Smooth,
skin.
like
Yes.
smoother than our skin.
Girl, yes. It is going to be red and pink. That's just because we just peeled off all those
You
years
look
of damage.
like a newborn baby, just out the womb. You know how they're just so, you can see all the colors in your skin,
Yes.
just these, perfectly red, pinkish tones.
Mhm.
You're going to look like that, and
Yes.
it's going to be like, whoa, Benjamin Button much? Did you watch that movie?
Yes, I did.
Because I'm pretty
I
sure
love
that's
it.
what happened.
That is actually what happens. I love that.
Yeah.
So once the skin is resurfaced, it is going to be pink and red. The pink and red is not permanent. It will go away. Sometimes patients within 6 to 12 weeks, that red or pinkness has come down. It can most certainly be covered up by makeup.
You're not going to really need it. You're not going to need. You're going to want to throw out all your makeup, and we're going to want to make sure
what you're using on your skin is
you can't use my MAC.
negative.
But we'll help you out with that too.
Exactly. So once the skin's resurfaced, you're going to start coming in for a couple of hydrating treatments because at this point your skin is going to be so tight, you're going to start to feel some of this dryness because now we've weaned you off. Now you're not on Vaseline anymore because you've resurfaced. Now we're on a hydrating, protecting regimen. Mm-hmm. So we're going to give you that. So
Thankfully,
you know exactly.
we have an amazing esthetician
Girl.
that does her thing.
Mm-hmm.
She is
She whips your
essential in the phenol peel process.
Mm-hmm. Yeah. So we get you on a nice regimen, and then what is your last?
Stavina,
Yes.
Stavena.
I like how you spell that out.
Mm-hmm.
Yes, Jessica Stavina. That's me. That's your girl right here. Okay, so post-care treatments that we're going to do on you, and then a post-care treatment product regimen we're going to give you. Okay, so I want to show you.
And we're not going to we set you up. You buy the products, and we'll tell you when to start them. Some of them you're just going to start in the beginning.
Mm-hmm.
Then later on, okay, remember that other thing that we had you buy? Start it then. Do you give it to them all at once, or do we give it to them?
So all the pre-treatment stuff we give to you because obviously you need to start that. The post-care It varies on a case-by-case basis because some patients, because they are traveling from out of the country, out of state to us, it's a bit harder for them to get here, at 3 weeks or 4 weeks out.
And to get all your stuff on the plane.
Oh, they have to check their bags usually.
Almost threw away my hair serum when I was coming back from Cancun, and I was like, listen, I can guarantee you the only thing I'm smuggling is, like, calm hair. So... Anyway,
I love it. Yeah. So our patients that are flying in for the procedure, whether it's out of the country, out of state, or 4 or 5 hours away, we typically will go ahead and give them their post-care instructions and tell them, pump the brakes, don't touch this, don't mess with it, put it away, and we'll remind you when to get that out and start using everything. So it's a case-by-case basis whether you're going to get your post-care out of the gate or we're going to give it to you when you come in at the post-op time. Okay. So that's a good question. I do want to show some photos.
Yes.
Oh. Okay. So
I was almost like, should we take them to the wall of phenol? But you got it covered.
Okay. So Ashley mentioned something about like being in your 30s or your candidate. Maybe not. This particular patient is actually in her late 30s. Okay.
So one important thing to say is, how can he do it on someone that's in her 30s and then someone that's in her 70s? Because he knows the levels. Like, he will assess the skin. And it might be in surgery where he's, okay, this person is more advanced than this person or whatever.
And there are different parts of the face that he does, a more aggressive combination of the peel on and less aggressive depending on, where your needs are. Yeah. And, we may have a 40-year-old that is more advanced than a 60-year-old. So age is not a huge factor in this.
If they're Botox babies like me who started getting Botox when she was...
You probably won't need a facelift until you're 94.
That's the hope.
Okay, so I want to show you this photo because this particular patient is in her, like I mentioned, she's in her late 30s and enjoyed the sun a lot, okay? Even lived in a state where it's super sunny.
I promise I never tan, I'm sorry, I never tan this much. Like,
dude, when Ashley came back, we were like, is this even not, like, who are you?
Jessica, anytime I would ask her, like, oh, okay, so what's going on with, she's like, I can't talk to you right now.
I know, I'm distracted by the tan. Okay, so let's show this.
Are you ready? Stop that because I don't want to.
And I feel like you probably can't see like how much damage she has in this because we're on camera.
Oh my god! Look at hilarious Kim. She was like,
just so you
looks like I was dipped in a bag of Cheetos before. See, sun damage,
girl.
Tanning.
I cannot wait. Okay, so you're ready for this? I'm gonna block Ash and I. Okay. So let's get high and tight in here. Okay, so let's get out of the light. Oh, you know what? Okay, hold on.
Turn the light off.
Okay, hold on. Let's do this. Okay, so let's just enjoy and appreciate this real quick. Okay, so pre-op. Okay, she's got pigmentation up here, and again, this is on camera. So if you get on our website,
it's backwards, huh?
Before. Yeah, it is. Yeah. I think there's actually a way to. No, not that.
No, don't do it.
I won't do it. Okay. All right. So beforehand. I mean, she looks great, but she does have some problem areas that, of course, someone in their late 30s would not be ready to be dealing with, right? So she's got facial aging lines in through here, okay? And then she's got some sun damage up and through here, okay? So pre-op, post-op. Another thing I want to point out is, look at her eyes. Do you see the hooding here? And do you see how this looks more open?
Ooh.
Do you see that? What? The phenol, because we are doing a controlled burn. Okay, I'll get high and tight in there. Okay.
Yeah. There you go.
Because we're doing a controlled burn, you get epidermal thickening. So we get tightening of the tissue. Okay, which is super important because who doesn't want tight skin, right? But the tissue thickens as we get older. Our skin thins out. That's when we start getting laxity and start seeing these things. So when we've got nice, tight, thicker skin, we can really appreciate that. This is 3 months post-op. So this patient just has mascara on. She may have a light layer of powder, but you see she's not red, not crazy, weird, funky looking, okay? All right, so there's one.
Not that she was before.
No. Definitely not. I'm just talking about being red. Okay, cool.
So I'm going to show the next
okay, you do it.
Picture while you get Kim's picture.
Oh, yeah.
Okay, so this is one of our faves. This is Miss Rose. This is Mary, our lovely Mary's mom. Look at that. That's before. Look, she's even happier. Look at that. She is the one that keeps a picture of her before in her purse to show everyone. you can just see a more youthful appearance. Isn't that crazy?
Amazing.
Look at that.
So amazing.
She really does look happier and more youthful.
Y'all, I cannot wait to show you Kim's photo. Okay, Kim, you are giving us permission. We can show you, or show your photo, right?
Kim,
make sure.
Can you just give us permission real quick?
Because oh my gosh.
So
Sister.
that's amazing.
Okay, no judgments on my computer screen, okay, guys? Seriously, because
Jeez, Jessica,
I
you have
dropped
to
it.
bring the ghetto.
I dropped my computer.
Okay.
I was loving it too hard. Okay, let's look at Miss Kim. Look how amazing.
Can y'all just
even okay? I just want you to even look like.
What if I turn off this light?
Brows, upper
Will
lids.
it be too dark?
We've got lid tightening in through here, so we've had a little bit of laxity there. Okay, and look how much more open her eyes look. These lines around the mouth. Look at that.
Gone.
So amazing.
Girl.
Look. Daughter.
Mother.
Look at that. I love it.
Mm-hmm.
Kim, you're so amazing for sharing your photos. Thank you so much. We have so many photos that we could share with you guys. But these are just some, I think these are really great examples of patients in different ages and different stages of sun damage or even facial aging.
Yeah.
So,
next time you're at the office, please check out the wall of phenol.
Yes.
Awesome. Yes, Sydney is another one of our amazing results.
Mm-hmm.
I mean, they're all amazing. So we will post some more pictures. Ask us any questions. I think we went over pretty much everything.
So yeah, I think we went from start to finish. And then I do want to point out this picture of Mary's mom, Miss Rose. This right here is literally, I'm going to turn the light off again. This is 21 days post-op. 21 days, 3 weeks. And again, this is a printed photo, so our pictures on our wall of phenol are clear. On our website, they're clear. But
but the lighting is the same.
Yeah.
And you see how we brought her back to her original baby color.
Mm-hmm. Yeah. It's amazing. So, I just wanted to point that out. This result right here is just 21 days post-op. She's got some light powder on, I think some mascara. Mm-hmm.
Oh, good point. Miss Kim,
no sun.
She's like, no mo sun for this face, which is true. I'm not a very good plastic surgery worker today because I know the effects and I know what happens.
Oh my God, yeah.
But we're going to correct it. And I'm not going to be... I swear, I wore the stuff. It just kept running out. And when you're in the middle of a catamaran, you can't just okay, let's go back to land real quick because I forgot oops. I did forget.
She just totally told on herself. Jana?
Sorry, Jana.
Get on this, girl.
Okay.
Okay, so I think we covered it. I know today's was lengthy, which we're pretty much chatty Cathy's all the time. So they're always long. So
and it was us coming back together.
I know,
so I missed my wifey.
I know. So we really appreciate you guys, whoever stayed on and hung out with us. If you missed the beginning, go back and watch the replay. If you watched the beginning and missed the end, come follow on through, sister. Finish it out.
Share it.
Yes.
So that all your friends can also see what's going on.
Yes, because you may have friends and family that didn't even know that this would be an option for them. Mm-hmm. So definitely click that little button down there that says share.
Yeah.
And
and then also, I just want to give a quick shout out to my amazing brows, because they were created and microbladed by our very own Andrea.
And look out soon, because mine are about to be redone in the next couple of weeks. So
I wake up made up, y'all.
Carrie said, my favorite show thus far.
Thanks, Care Bear. Oh, we love you too, Kim.
Yes. Awesome. Love you, Kim. Thank you so much for watching and letting us share your photos. We really appreciate that. We're actually going to post them in the comments. So our other followers that have had the procedure, is Sydney, if you want to drop yours below, we can actually drag and drop. But share your photos down below. We just are so happy that Dr. Shadar is able to provide this for patients. It has been for many, many years.
This is the procedure that people just, sometimes you want to be private about your before and afters, or you don't want anyone to know. you want to shout it from the
like,
rooftops. Look at me. I just Benjamin Button 20 years.
Mm-hmm.
So.
Or more.
Yeah.
I've had some that were
Definitely.
like, what?
So, be sure to tune in next week because I haven't told you, Jessica, yet, but we will be wearing costumes on the PS show.
Ooh, I want to do something crazy with my makeup.
Yeah. Oh, well, then we're going to have to prep from the night before because you have to do my makeup too.
We're going to need to get here like 5 a.m. on Friday.
Yeah.
Okay, so thank you guys so much for watching. We
Please
truly
tune
appreciate
in
Yes.
next week.
Mm-hmm.
Share, comment, love you.
All the loves, all the hearts.
Oh, thanks, Letty. Letty says my eyebrows are on point. Oh my god, everyone needs to do it. But anyway.
Yes, okay. So.
Go Astros.
Yes, we're taking it back. Take it back. We're taking it back in time with your skin, with your face, with the Phenol Peel with Dr. Sukar.
Yes.
And, thank you so much for watching the PS show with
Ash
and Jess.
And remember, beauty is in the details.
Thank you guys. Have a great weekend. See you next week.